Hi, my name is Jackson Pohlman, and today I will be discussing impaired mobility and health concerns related to limited activity. Impaired mobility is defined as the limitation in independent and/or purposeful movement of the body or extremities. Lack of purposeful movement is caused by a variety of things. When most people think of impaired mobility, they think of injuries such as spinal cord injuries that can lead to quadriplegia and paraplegic. Other injuries include extremity fractures, back fusions, and even something minor like a sprained ankle can lead to impaired mobility for a short period of time. Other causes include neuromuscular disorders such as cerebral palsy, muscular dystrophy, multiple sclerosis, and fibromyalgia. Genetic disorders such as Down syndrome, cystic fibrosis, and even autism can also cause impaired mobility and impact someone's daily life as far as getting around and functioning on a daily level. Studies show that about 7.8% of adults are unable to or can barely walk a quarter mile here in the United States. Utah's population has about 9.1% of people that have mobility-related disabilities. When I first looked at these statistics, I was pretty shocked. When you think of a quarter mile, I can compare it to driving approximately 15 seconds driving 60 miles per hour on a freeway. When you think about it that way, that's not a very far distance at all. And it's incredible that about 8% of people can't make that distance because of a disability or injury or something that's limiting their ability to move. These people who are impaired physically are at a huge disadvantage as far as education and employment because they're often unable to make it to class, make it to work on a consistent basis. These limitations lead to increased health complications, lack of financial stability, and a decreased quality of life in severe cases. Impaired mobility also affects Maslow's hierarchy of needs. A perfect example of this is breathing that can be diminished due to high cervical vertebrae fracture. This can lead to the need for a ventilator full-time or part-time, depending on the situation. But something such as breathing, which we all tend to take for granted, can be affected by a physical impairment such as a spinal cord fracture. Sleep may also be interrupted by pain. Self-esteem and confidence may be reduced just because someone is not able to live their normal life and get around and do activities that they used to do. And so all steps of Maslow's hierarchy are affected by the inability to move freely and independently. Other examples are employment. We've already kind of discussed that, but someone may struggle to maintain a job just because they're unable to get to the job and perform certain job duties. There are wonderful resources out there to provide jobs and education for physically impaired individuals. However, it's a daily challenge to get up and accomplish these goals. Other items along Maslow's hierarchy include friendship, intimacy, and family. These things can also be impacted by physical disabilities and restrictions because it's a lot of work for friends and intimate partners and families to be patient and work with individuals with physical mobilities because it takes them an often longer period of time to do things and accomplish tasks. There are several individuals who suffer from mobility impairments that struggle maintaining friendships and relationships. For this next slide, I want to focus primarily on spinal cord patients and individuals. The reason for this is because respiratory diseases such as pneumonia are very common and extremely dangerous to this population. Pneumonia is actually the leading cause of death in people with a chronic spinal cord injury. This is because they're not able to get up, move around, cough, deep breathe, and so fluid and other buildup can just kind of sit in their lungs and really start to affect their breathing pattern and just their overall respiratory state. Non-communicable diseases or infections are also a concern for this population. Arthritis, chronic pain, depression, sepsis, pressure ulcers, deep vein thrombosis are some of the more common and dangerous diseases and complications with impaired mobility. If you look at this graph on the right, the far outer bubble has a section that's lack of mobility or physical inactivity. And if you look at this graph, everything in that light blue section on the outside covers the other ones, such as cardiovascular disease, diabetes, cancers, chronic respiratory illnesses. And that's because people who aren't able to move and be active are at a risk for pretty much everything. You always hear in healthcare, exercise, get up and move, be fit. And people who are unable to move and they have that impairment are at risk for pretty much every disease and disorder that exists. Sepsis is common in this population mainly due to pressure ulcers. The pressure ulcers can break open and become infected, which can lead to sepsis. And to start, the pressure ulcers are generally caused by the lack of ability of people to shift position and reduce pressure to either their bottoms or heels or areas of their body where they're more susceptible to this increased pressure and weight. Another common problem with this population is self-harm, which is very unfortunate. Studies have shown that 5.8 to 11% of deaths in people living with a spinal cord injury were caused by suicide. Going from living a fully functional life where you're skiing and rock climbing and swimming and being active and kind of doing whatever you want to all of a sudden becoming restricted, and you're not able to move, you're not able to get out and do certain activities, and this change can be really hard on people. So if you know someone that has a physical mobility impairment, reach out to them, be a friend, be a supporter, just go and talk to them and support them. And just, it's important to understand that suicide is very, very common, and a lot of time it can be prevented if someone would just reach out to these people and be a friend and just support them in their new lifestyle and just help reassure them that everything's going to be okay. Chronic impaired mobility is something that you can't escape. It affects you on a daily basis. However, I know some people that thrive on their lifestyle that they've had to adapt to. I personally know a couple quadriplegics who struggled for a few years after their injury, but now they've kind of learned and adapted to their new lifestyle, and they find ways to get out and go biking and to go skiing and live as normal of a life as they can. And I personally applaud them and I support them, but they have this crazy, amazing mindset as far as life goes and how to live life to the fullest, and it's incredible to witness in person.